Doctors or therapists of Reddit, do you have any no, that's not normal stories? If so, what abnormal habit oddity did the patient have thinking it was normal? 50-ish-year-old man who came in for chronic issue follow-up, he brought his wife with him this time around. At the end of the visit, she says, "Hey, tell the doc about that thing you can do." He turns to me proudly and tells me that he can whistle from his penis. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. Mom brings her kid in, because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being an asshole and not listening to them, or being absent-minded. Kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said about once every 2 to 3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once to twice a month. I'm sure I have more, but I think I wrote enough for now. Oh yeah, I have a lot of stories involving skin lesions. Please people, no doctor will ever fault you for wanting to just get something looked at. There are a few easy ways to tell if you're looking at something potentially evil. Got amends the above edit due to people's bad experiences. No decent doctor should blow you off if you're concerned about a skin lesion. They should at least take the time to discuss why it is they're not worried about a lesion if it's not concerning. My family wanted me to see a doctor. I refused because it's only a few skin ulcers, it's not that big a deal. It's only a dozen skin ulcers. They'll heal fine. Fine, if you're so worried about the 40 skin ulcers, I'll go to the doctor. So yeah, now I have lots of scars. But in my defense, I was clearly extremely ill. It's likely I wasn't thinking clearly at the time. Memory's pretty hazy. Any doctor who treats a patient like they're a waste of time for something concerning is a real piece of work. The fact of the matter is that there are a lot of manifestations for skin cancers, and some lesions that aren't skin cancers can be signs of other things going on in the body. No one has ever been killed from a simple shave or punch biopsy, but those simple procedures sure has saved a bunch of lives. Woman came to the hospital because she was feeling tired and casually mentioned her persistent vaginal bleeding she'd been dealing with for 2 months. She said it wasn't ever a large amount, so she didn't think twice about it. Labs were done, and her hemoglobin was 3.9. For context, that's low. Like, you should be dying low. But she looked perfectly fine. I was the patient, but when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? Might be your bellies." "Oh, since I was 21 probably." Turned out that, no, the beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really shitty friends. Had to have emergency surgery, and for a week or so there did not know if it was a cyst or ovarian cancer. It was a pretty big scare. This was a time I was told something I did wasn't normal. I was in physical therapy recovering from a back surgery. My in-home physical therapist was having me do stretches and asked me to extend my leg as far as possible and straighten my knee. So, I do this and my knee inverts, which to me was totally normal, but my PT was very surprised. She explained that was very abnormal, and she had not seen hyper-flexible knees like mine before. So now I know my wonky bird knees are not normal. It has been really great to find others who are also hypermobile. No one else in my friend family group are like this. I've added an illustration of what a hypermobile knee joint looks like for those curious. I've had this with every medical professional I've talked about my hypermobility. For example, I dislocated my finger at the knuckle, and then popped it back in. I was telling the doctor and they were like, "You can't have done that," and they tested the range of mobility in my finger to show it would be super swollen and immobile if I had done as described. I told the doctor I can usually bend my finger way more than that and explained I was hypermobile. "Doctor, oh yeah, show me," Me, bends arm to show hypermobile elbow joints. Doctor, oh my god. Stop. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs, jiggle, and then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my bogey, after charting my symptoms for 6 months. PMDD, a depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis, oh yeah, remember in high school? Your friends would come over and ask if you were crazy that day or not. No mom. They didn't ask me that. Thanks for letting me know. 95-year-old veteran 5 years in remission from kidney cancer. Came in with 72-years-old wife for routine follow-up. She wants to know if it's safe to have sex every day because she is worried about his health. Yup. 95 yo. Fucks every day. No Viagra. We just said, congratulations. Yes, sex every day is very good for your reproductive tract, penis or vagina. It keeps blood flow going and helps you maintain function of your bits for as long as possible. Use it or lose it, essentially. And it doesn't have to be with someone else either. Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive lint picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall, he said, oh okay, I guess. Just a little tired, drank a little more this week than usual. Probably overdid it. I had to pry for details, and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff, melina digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the doc examine his belly button. When I finally got on medication for my anxiety, I found out getting irrationally angry and frustrated almost to the point of crying and screaming at people for touching things certain ways, putting the dishes away wrong, chewing, moving my stuff a few inches or talking to me when I didn't feel like talking was, in fact, not normal. Thank God for Prozac. Not a doctor, but when I was maybe 14 or 13 I remember describing to my primary how during my periods I would pass out from the pain, couldn't move or I would get sick, and told her a story about how I went on a trip to Italy, and sometime in the middle of the flight, became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry flight attendants, bye. Filling 4 puke bags, crawling to the back of the plane clutching my stomach, finding the doors locked attempting to use the first-class bathrooms, so I could finish being sick, when denied entry just lay down in the aisle waiting for sweet death to take me. It did not. Death has terrible customer service, and then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, honey, you're supposed to experience some discomfort not being incapacitated anyway. She put me on birth control, and I've never been happier. I'm a patient who thought it was normal to have a headache nearly 24/7. It was actually the occasional absence of a headache that I initially believed to be problematic. There are a lot of people asking, largely via DM, what my disease is because they think they may have the same thing. I'll call my disease X for now. Headaches is one of dozens and dozens of symptoms of X. Headaches is not a defining characteristic of X, and many people with X do not have headaches. Headaches alone would definitely not lead to a diagnosis with X. X is also rare. It's so rare that if someone I know saw the name of X on a Reddit comment, they may actually know that ANONYMOUSREDDITOR17 is me. Thank you for understanding why I'm keeping my diagnosis quiet online for now. I wish you all the best if you're struggling with headaches too. For me, water, sleep, and physiotherapy are enough to keep me fully functional despite my headaches. I feel like my story belongs here, even though I'm the patient since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result, I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So, one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely, she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. I had a root canal needed in a molar. I went in, so he could prep it for the next step, but 2 hours in, and he had to call it for the day. So, by the fourth 2-hour visit, when it was finally done, I was sick of seeing my dentist. Almost a year later I'm back at the dentist, and he turns to his assistant, and says this is the one with that root canal. I'm a legend, apparently. This happened to me. I woke up with a period so heavy the bed was soaked, stood up and it just poured out of me, clots the size of my palm. Overwhelmed I did what any woman would do, if they could, and phoned my mum to come over, and comfort me, and help me clean up the mess. At this point I was still thinking, this is a strangely heavy period, and I was more worried about how my landlord would react to the carpet. I then fainted, woke up, fainted again, phoned mum to cry about my stupid period making me miss work. My parents called an ambulance, that arrived to the house first, and rushed me to hospital, not period. Massive internal hemorrhage in the womb. Obligatory. I'm not a doctor, but I have celiac disease, and am in the process of getting a Hashimoto's hypothyroidism diagnosis. I was the abnormal patient when I was a little kid, because not only did I get monthly bladder infections, apparently, I had to use a catheter for a while, but I don't remember that at all. My doctor was confused why I always had extreme gas, joint pain, and weekly headaches at the ripe old age of 6. Turns out it was just me slowly dying, because I ate a lot of wheat bread with celiac disease. I flew off to South Korea in 2012 as an unknown celiac on a 1-year teaching contract. I almost died, because none of the doctors had a clue what was going on with me. I got back to know after 13 months, went straight to the doctor who referred me to a specialist who basically said there was no need for an endoscopy, because the antibody count was so extremely high. So, I feel you. My celiac disease demolished all my weight and my immune system. Had a 3-month bilateral ear infection. I was in such a state. I'm a patient. Growing up I assumed I was struggling in school, because I was just a stupid miserable fuck-up. I had zero confidence in myself or anyone else. Sometimes I would go days without sleeping, other times I would sleep all day. I thought about my own death constantly. I truly believed that I was a flawed person, and that it would always be that way. Turns out I actually have bipolar disorder. And thanks to medications and therapy, I am a normal functioning human now. When I was in medical school, I had a mother come in, because her son was having behavioral issues at school. He was skipping, depressed, didn't take long to find out he had encopresis. He basically pooped himself without knowing it, which would be hard at any age, but especially in school. Deep dive. He played Xbox every waking moment with no bathroom breaks, stretched things out until he lost sensation, and stuff could squeeze out. Edits. Sorry late night posting. Swipe. Lots of edits made based on used comments and feedback. I was a patient. When I was growing up, I had constant stomach aches. Every time I ate, I'd get sick. I went to the doctor multiple times for it, but they could never figure out what was wrong. Eventually, I started to think that everyone lives with pain like that, and I was just being a wimp and couldn't deal with it. I barely ate, such that I was super underweight. I was miserable all the time. I was constantly stressed and depressed because of this problem. Fast forward to grad school. My first year is in China. I'm there for a few months and then, over time, my symptoms disappear. I don't have stomach aches anymore. I gain about 40 pounds seemingly overnight. Now I'm at a healthy, doctor-approved weight. My depressive symptoms disappear almost entirely. But how could that happen? What could have caused such a change? Turns out, I'm lactose intolerant. I grew up in the Midwest, where pretty much everything has dairy in it, and I'd been eating it constantly for so long, it took months for my system to reset. Being in China where dairy isn't such a staple made all the difference. I felt like such an idiot when I realized that was what was making me ill. On the plus side, I feel better, look better, and am a much happier person now. Constant nausea and stomach aches are not normal. I was the patient, but I walked into an urgent care clinic after I had pushed my teeth through my bottom lip. I was covered in blood and had a large hole in my face. I told the nurse who did the intake I was having trouble drinking water and was worried about dehydration and did not acknowledge the new face hole. She got real freaked out. Obligatory I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. Not a doctor, but I had close calls. For a few years, I often found myself falling asleep at a certain time, often after work. However, with family advice, I went to the doctors and explained the symptoms. I was checked by a specialized in autoimmune diseases, as that ran in the family. I was given an X-ray and blood work. They noticed my thyroid wasn't working, given the second of 2 cancer scares. I was eventually diagnosed with Hashimoto's thyroiditis and psoriasis, thanks to unusual on my skin. I was put on hormones and steroids, likely for life. Customary not a doctor or therapist part, but I don't know if I'll ever forget the moment I was told by my psychiatrist that I, 12 at the time, was experiencing emotional abuse from my mother. It was an immediate not my mother, surely. Because at 12, you totally know what abuse is. I, 13 years later, can definitely say that I was raised in an emotionally and physically abusive household. I was the patient, but mine was kind of backwards of the whole thing. I feel like it's close enough to fit. When I lie down on my back, my feet turn out lay completely flat. They've always done this, my bones in my legs are twisted and that's the most comfortable position for them. This was the day after I broke my pelvis, and I was going to the doctors to see what the damage was. The doctor didn't know about my feet, so he had this terrified look on his face when he saw me, and had it back out. My mom had to talk to him and tell him no, that was normal, because he assumed I broke both hips. It was more like, I realized what was happening was not normal, and it led to the client being diagnosed with what I can only assume was rapid cycling bipolar 2 with psychotic features, was referred to a more appropriate agency after initial intake, so I didn't do the official diagnosis. He came in and was so down about his life that I called in another therapist to do a suicide assessment together. Once we were going through the questions, the client became excited at having an audience and did a 180 in demeanor. I had never experienced someone flip so quickly. Aside from the mental health stuff, the client was a really cool person whom I hoped would get proper medication and go on to live a happier life. Lots of achievable hopes and dreams, and a really intelligent person, delusions aside. I'm a doctor. It's about me. In my psych rotation, me and my fellow students were interviewing this anhedonia patient. The guy asked him, does it feel like nothing matters, and that you'd rather die? I probably responded, of course, but that's just normal. Thinking about death, because there's so many bad things in the world that we know for sure are happening, but have no actual way of subverting or preventing. In my mind, scenes of forced prostitution, organ harvesting, domestic abuse, serial rape, sadistic torture. They just all collectively said, no, that's not normal. If you're having problems, please tell us more. I just responded, oh, and justified in my head that it's just a lack of proper communication. I was fat. I thought my belly button, about 10 centimeters in diameter, was huge because I was fat. No one knows how long I actually had the hernia for. When it was first diagnosed, the docs tried to push it back in, and it wouldn't go. I was told that due to my chronic severe brittle asthma and prescribed steroid use, that I wouldn't be given surgery to fix it, unless it was strangulated. 7 years later, surgery was planned for a year after another surgery. It strangulated during an exam I was videoed for. I finished the exam, and I had emergency surgery a couple of days later. My lecturer was marking the exam and noted that I went very pale and started sweating halfway through the exam. I passed the exam, although I am sure I could have gotten a medical certificate if I hadn't.